But he's going to have to speed read because Republican leaders want to hold a final vote in the House on this plan within the next couple of weeks, DeMarco, even though lawmakers still don't know how much it costs and how it's going to be paid for.
That's a big concern there. Nancy, the last few days we have seen the president and Speaker Ryan doing what they can to sell the American Health Care Act. What's their strategy now to make their case directly to the people?
Well, the main people they need to win over right now is this group of conservative lawmakers. There's really no point, frankly, in trying to win over Democrats or anyone else in the public until they know that they can convince these conservative lawmakers to get on board. They don't need all of them. They know they won't get all of them, but they do need some. And that's why the president was meeting on Wednesday evening, rather, with a pretty impressive group of leaders of conservative organizations like the Heritage Foundation, like Americans for Prosperity. These are groups that raise a lot of money for conservative lawmakers and are very well respected by conservative lawmakers, and they have almost universally come out in opposition to the GOP plan. That is a big problem for the president and for Republican leaders. Those organizations, their leaders came out after the meeting with the president. They said that it was a constructive meeting. They were encouraged, but they certainly didn't say, DeMarco, that they're changing their minds.
So with that said, do you expect this approach will get members of the Freedom Caucus like Rand Paul on board?
Paul says that he's still waiting to hear what's on offer from Republican leaders and the president. It sounds like it would take quite a lot to convince him to get on board. The problem is that a lot of these conservatives have an issue with this bill that can't be fixed simply by scaling it back. They're not saying that they think the tax credits for low and middle income Americans to help them buy insurance are too large. They're saying those tax credits shouldn't exist at all. They have other problems with the bill. And so it's unclear right now what Republican leaders could even do to convince them to get on board.
Nancy, let's go ahead and talk about the Democrats. What strategy are Democrats taking? Are they right now just going to sit back and let the Republicans sort of fight amongst themselves?
They're making it clear that they have a couple of big issues with this bill. They're talking about the fact that, according to most independent analyses so far, that anywhere between 5 and 15 million Americans would lose the coverage that they have now because it would simply become too expensive. They're also arguing very strenuously against all the taxes for wealthy Americans that are being repealed as part of this broader Obamacare repeal act. But beyond that, you're right that they are letting conservative lawmakers as much as possible do the talking because it really serves Democratic purposes to have a scenario where it looks like Republican infighting is what's going to bring this bill down, not Democratic stone throwing from the outside.
You mentioned this earlier. Republicans have not said how this will be paid for, and the Congressional Budget Office has not yet released its assessment of the plan. If it is most certainly less favorable, or how, I should say, how could it affect the bill's chances with more moderate Republicans?
Well, if the plan turns out to be prohibitively expensive, or if GOP lawmakers can't come up with an acceptable way to pay for the expense, then yes, that is going to be a big problem with Republican lawmakers. We've seen lots of cases with legislation where lawmakers like the bill, they like the plan, not necessarily in regards to health care, but anything, but they don't like how the plan is paid for, and that sinks the bill. So that is going to be a key component, and it is sort of curious that Republican leaders haven't said much yet about how they plan to pay for it. It appears that they're waiting to see what this Congressional Budget Office analysis looks like, how expensive it's going to be. Interestingly, the press secretary, Sean Spicer, at the White House today started doing some early damage control, essentially saying that the CBO has been wrong plenty of times in the past, and no matter what they come up with in terms of how expensive this bill is, and we expect that we will see those numbers early next week, that number will probably be off too. So it's probably not worth paying all that much attention to it. That probably didn't make the Congressional Budget Office, which is feverishly crunching the numbers right now pretty happy, especially because the head of the CBO was chosen by Republicans.
I had a final question for you, Nancy. Several major lobbying groups like the American Medical Association and the AARP have come out against the bill. How does that impact the debate on Capitol Hill?
Well, you know, the AARP has a lot of sway with older Americans, and so when it comes out against a plan like this, that's something that could cause people to sit up and take notice when perhaps they weren't engaged in the argument before. And if you see, you know, a wide array of groups that theoretically should be neutral and are seen as neutral by and large by Americans, that's going to create some concern about the bill that might not have been there otherwise. And so Democrats are already citing the conclusions of those groups. There are some op-eds that have come out in favor of the plan from some Republican-leaning groups, but so far Republican leaders haven't seen the kind of support for this bill out in the public that they'd like to see.
All right, Nancy Court, it's always good to see you. Thank you, Nancy.
You're welcome.